90-year-old Margaret Keenan, well, she'll go down in history. She's become the first person in the world to receive the Pfizer vaccine against COVID-19 outside trial conditions. These pictures are coming into us live now. I beg your pardon, we're coming into us now. This was actually about 25-30 minutes ago as she took that first injection. She's at the University Hospital in Coventry, that's in the English Midlands. The British Prime Minister Boris Johnson's called this a huge step forward in the fight against COVID-19. It has led to the deaths of more than 60,000 people across the UK, and the majority of those are the elderly, which is why the priority is very much focused on those elder citizens in the United Kingdom. Yeah, quite a moment. A round of applause. Margaret takes the jab, and that is the first of two, of course. She will have to have a second vaccination in 3 weeks' time. Our health correspondent, Catherine Burns, has the UK perspective. She is outside University Hospital in Coventry.
The government's calling it V-Day, and it is the biggest vaccine rollout in our history. So here in Coventry is one of 70 hospitals across the UK that are going to start injecting the first patients today. Now, we've ordered about 40 million doses of this. We don't have that yet, though. Right now, we're looking at about 800,000, and that's going to go up to about 4 million before Christmas. So not everyone that needs this injection is going to get it immediately. They're going to start off in the hospitals, for example, with inpatients who are already in hospital and about to go home, or people who are coming in for tests. They'll also invite some care home staff in and maybe some other vulnerable over 80s. And then if there's any left over at the end of each day, they will give those to the most vulnerable frontline NHS staff, the ones who would be at the most risk of getting sick if they got this.
Yeah, there we are. Well, our reporter Paul Hawkins is with me now. I mean, this is an initial 800,000 batch, isn't it? It's the first batch, so the elderly get it.
Yeah, 800,000. It initially goes to the elderly, it goes to those with underlying health conditions, and then it's gradually rolled out across the UK. 40 million doses in total the UK government has ordered. So when you do the maths, that's 20 million people, roughly around a third of the UK population. As you mentioned, everyone who gets this vaccine, they get 2 doses, 3 weeks apart. The immunity begins after you've had the first dose, and then it builds to maximum immunity 7 days after the second jab. So that's kind of how it works. Side effects, they're mild, 95% effective. It's not yet known how long the immunity lasts. That's quite key, and we don't know whether it stops people from actually passing on the virus yet, because this is the first time in the world that it's been rolled out.
Yeah, it's interesting seeing it actually happening after all this time as well, isn't it? Yeah. I suppose we've got to look at the scale in which this can be opened up quickly, because as a vaccine, Paul, it's held at very low temperatures. They have to administer it in hospitals rather than a doctor taking it off in his bag and carrying it around the town sort of thing.
Yeah, -70. So at the moment it's arrived in refrigerated, huge refrigerators, effectively, big containers shipped into the hospitals. That's where it's going to be started, 70 hospital hubs across the country. And then as they try to work out the logistics of transporting that virus at a really low temperature, it'll get rolled out in GP surgeries, in care homes. We're talking about 30,000 people being recruited by the NHS over the coming months. Sports stadiums, conference centres as well being used as vaccination hubs. So at the moment they're going for targeting the over 50s, and then well into next year we'll start seeing phase 2, which is under 50s.
Paul, that's really helpful. Thank you very much for that. I'm joined now by Professor Philip Clarke, who is Director of the Health Economics Research Centre at the University of Oxford, and his teams have been working on a framework really on how to allocate the vaccine itself. As I say, he joins me from Oxford now. Philip, thanks very much indeed for your time. We've just seen Margaret Keenan, the very first to receive the vaccine, and not surprisingly, it's targeted initially at the oldest and the ones we see as the most vulnerable.
Yes, David. The idea, I think, of the vaccination strategy in the UK is to keep it simple and basically start off with age, with the oldest, because people's risk of getting COVID and also perhaps dying of COVID doubles about every 5 years. So if you start with someone like Margaret, who's in her 90s, you're likely to reduce the mortality from this disease in the most rapid way.
Yeah, and it's an overwhelming increase, isn't it, as the years go by, if you like. Nonetheless, it might not be the only approach. And I think, would you perhaps see the idea of vaccinating all maybe the health service staff as a more appropriate first step?
Well, different countries are trying different strategies. Certainly in the UK, healthcare workers are getting a high priority. They're in the next group, and as well as social care workers. That makes a lot of sense, both to protect them, but also potentially to protect patients if it's able to reduce transmission. I suppose the question is, what are other countries doing? There is a variety of strategies here. So, for example, Russia has started vaccinating with its Sputnik vaccine, and it's vaccinating healthcare workers and teachers. So I do think perhaps there needs to be a discussion in all countries about where these occupations that have a lot of contact with the public will fit in alongside healthcare workers.
Yeah, I mean, obviously it's voluntary, and Margaret was very ready to be vaccinated there. But we did hear earlier, Philip, from Los Angeles, from a healthcare expert, saying that actually more than half of healthcare workers there still feel uncomfortable about this vaccine. And that's an issue of the speed, again, with which it's been processed.
Well, there's certainly been rigorous testing, both of all of the vaccines in terms of both its efficacy and safety. And of course, it's now being approved by regulators. I suppose also, though, these have been developed at speed, but there is, of course, enormous benefit, to the individual, but to the entire society from getting vaccinations rates up, because it's the one sure way to actually bring about a reduction in COVID cases and going back to a sort of normal world that we're in this time last year, and hopefully will return to by this time next year.
Well, you make a very good point, don't you? Just watching one lady being vaccinated it's a symbol, really, of what an extraordinarily challenging 9 months, at least, maybe a full year we've been through. I mean, this is a big day, isn't it?
Absolutely, and I think it is a vaccination is something where by taking a vaccine, one is benefiting everybody in the society. So Margaret, by taking her vaccine, is actually benefiting me because with an infectious disease, it reduces my chance of getting a vaccine. So it is something I think as a society we need to make decisions about. But it is the one way we can actually defeat this virus.
Yeah.